Wonderful. We are very excited to have Mary Pat here today for our Alumni Give Back session. She is an Accelerator Program alumni who graduated not too long ago, but she has some great insights into the journey of a medtech founder, as well as just entrepreneurship in general. As a quick little introduction, if you haven't met Mary Pat yet, she's the founder of Emmetros. She left a corporate role to pursue her heart work by launching Emmetros, and she's driven by a commitment to honor her late grandmother with the products that Emmetros creates. We're also very excited to have Laurie Lefer here. She's a seasoned medtech and health tech, IT, and informatics professional with a diverse experience, including software engineering, software architecture, integration, and product management. Thank you to Artemis as well. They're our sponsor for today's event. Erin is here and she can certainly ask questions, and she's in the chat as well. So I will hand it over to you, Mary Pat.
Thank you. Laurie and I did a little bit of work before today to kind of determine who was going to speak first and whatnot. But I think it would be great to first hear from Laurie about a little bit more about herself. And I mean, I have a whole story to share about kind of the Emmetros journey and how I started the company, but I think it'd be really great to hear from Laurie a little bit more about how it came to be that she and I are doing this together.
Yeah, thank you, Mary Pat. Yeah, for sure. And I'm so excited to be here with you and the Accelerator team here to talk about our experiences, because certainly in this region, it's not only a really strong technology ecosystem that we have here in the region and even in our province and country, but medtech in particular is a particular strength, and that is where my journey actually started. I've spent my entire personal and professional life in this region. Was fortunate enough to be here because of my passion for healthcare. I wanted to participate in the healthcare industry. But I also had sort of that passion for tech. So, as the introduction there, I started off as a software engineer, but progressed eventually into product management, product marketing leadership roles and things like that at various companies in our own area and then across Canada and the US. And I've been bringing that experience to bear here in helping a lot of our tech entrepreneurs to navigate the healthcare system, in particular, startup and scale up organizations like your own, Mary Pat Emmetros, which is achieving some great success lately. And so spending a lot of time teaching at Conestoga College in the health informatics bachelor degree, working with the board of directors at Waterloo MedTech, and then mentorship through organizations like Communitech or events like this here at the Accelerator. Really looking to do a couple of things, right? And that is one, help medtech innovations get into the healthcare system, because I know that is a big challenge. And I want to hear more about that from you, Mary Pat, but also to help us sort of navigate the growth that happens in these organizations. And medtech in particular is a very unique industry in terms of corporate growth and strategy and what needs to go into that. And so, Mary Pat, with that in mind, I actually would be really interested in hearing, your transition. You came from a non-medtech industry in sort of that leadership role, and certainly there are going to be some parallels there, right? Particularly privacy and security and those types of considerations. But what was that transition like for you as you transitioned into medtech as an entrepreneur and started pursuing your dream and your passion for Emmetros?
That's a really great question. I love how we're digging into actually answering questions and not just giving the standard kind of how I started my business story, which is typically how things go. And actually a lot of the people here, I can see the names that I recognize. Most people here that are attending today are somewhat familiar with my story about how I started the business and why I started it. What I did not anticipate coming into health tech, honestly, before I started, was how different it was. The additional rigor required regarding kind of regulatory requirements, the additional due diligence required, the patience from investors required. You need a lot more time to do your research before you actually even get started selling in medtech. Where in another industry, say, because I was at RIM, which became BlackBerry, you can put something out in front of a consumer or a user, and if it delights them, if it's useful to them, you can start selling right away, and that you kind of can have a just a basic land and expand approach with your product. In med tech or health tech, even in my world, which is really, kind of a software focus, you have to do your research to prove that this is actually going to be helpful and not harmful to people with good reason. And so while there's great opportunity in med tech for technology, there absolutely is a lot more rigor required. And so if I were to go back and say, if I had only known, that question I often ask, say that phrase, if I had only known, what would I have done differently? I almost liken it to, if you had known how hard it was to have children, would you actually, like if you had known everything, would you have said yes to that first one, knowing how hard it is? I think it's a similar thing. If I had known how hard it was and how much work was required and how much investment would have been required to do a good job, I don't know if I would have started it, to be honest. It has been a huge learning curve for me. And I think, people do have a leg up that have a background in healthcare before they start a company like the one I started, that just understanding the rigor and requirements there. If I had known those things, I'm not sure I would have taken the path I would have taken, but because I did take it and we just took it one step at a time, we just kept kind of accomplishing the goals one step at a time, which would be to take the time that's needed, to take the 1,500 hours to work with the patient group in that first year, to raise that first round of funding, to learn all the lessons, to hire the people, to work with lawyers, to learn about all of the requirements that you're going to need to fill in order to even sell that first product. We just took it step by step, but absolutely was a hurdle to shift from a company that was really a consumer and enterprise technology company into the health tech space. You probably see this all the time, Laurie, which is where you have an entrepreneur that has a great idea. And just like me, this is their heart work. Quite often people who get into health tech are no different than me. They have some kind of an emotional tie to someone that maybe didn't have a good experience, or they had a particular medical problem that you think, okay, I'm going to be the person that solves this. And you just don't realize the heavy lift that is to even just get started.
Yeah, absolutely. I see that a lot with our medtech entrepreneurs. And there's one thing that everyone shares, and that is that passion for something, just as you said, right? It was either a family member, it was a personal journey, or it was something that really drove that idea and that innovation. But then as you started highlighting there are so many steps that have to happen in between, from taking that idea all the way to fruition and getting it into the healthcare system, which can be a bit of a road to haul for sure. Before we kind of get into that, because I'd actually like to talk to you a little bit about that, because I know there's a few things that kind of come up in common themes, and I'm curious how those things affected Emmetros. But before we do that, I just wanted to say, I am so glad that you did end up, you didn't know that you didn't know, so that you did pursue this, because patient engagement, I think, and for everyone here, I know there's a bunch that are familiar with what you do, but maybe it would be worth taking just a couple seconds and going over that, because what I see in Emmetros and what you have accomplished there is different. And I know when you started doing this, I would have said it wasn't ahead of its time, right? And I'll tell you why I say that, right? Because when you started this journey with Emmetros and patient engagement, certainly consumerism in healthcare was a hot button topic, and patient engagement certainly was something that was being called for out there, and largely, I imagine, driven by everything else that we have. We have free access to at our fingertips of our banking information. We have whatever, we can check a movie time. Why not our healthcare, right? Why not that? But that actually took patient engagement in a funny direction in my mind, right? It took it from really engaging with patients and creating, as you say, a delightful experience, and more towards, well, how can I just dump as much information as possible on the patient and make it very much like I'm logging into my online banking account and pulling out my healthcare statements and looking at all of that. And to most of us, we don't really understand what that means, what to do with that information. Sure, it's helpful to have it, but what Emmetros does is really quite different. Maybe spend a couple minutes talking about that, and then we can dig a bit more into your journey, diffusing this into the healthcare system.
Mm-hmm. So I think actually this is a really good point to share more about what does Emmetros do and about our journey, because we haven't really told that story. So I know quite a few people here know the story, but I'm sure there are some names I don't know. And I think it would be good to just give you an overview of what, kind of what our mission is and how we have evolved to where we are today. And I'm going to keep the focus on your question. So what we did was, when we started, our mission was to improve the patient experience. So to look at the experience of being somebody who has to receive care, whether it's from a home care provider or a doctor, or you're in a residential care setting, and you're the recipient of care, and how that makes you feel. And to be this person that was somebody typically in their earlier years was quite proud of who they were, lived a life, independently, making decisions on their own. We're now, because of either age or, health-related age issues, this is where we started, we're now dependent on others to care for them. And how were they treated? Were they treated with respect? How did the care experience make them feel? What could we do to empower those people and make them feel like decisions are being made with them, with their input, and not just have things done to them? So this was the start of it. And we spent, oh my gosh, a couple years building a prototype and selling a product that was just for them, called MemorySparx, which it was MemorySparx One. It was an iOS app. We sold it on the App Store, and we joined the AC, and we had a small team, and we spent a good year or 2 years just doing research using that app and understanding, going to memory clinics, working with people. About 1,500 hours we spent understanding what is it that matters most to the patient. That was how we started. We said, let's start with them and see if we can give them what they need to feel more empowered and more confident and able to advocate for themselves. Even if they're experiencing cognitive decline, they have something that they feel is going to help them contribute to their care experience and have more confidence. That was the beginning. So we started with the patient. We didn't look at the system. We didn't look at what do hospitals need. We didn't look at what do home care businesses need to become more efficient. We didn't look at the Canadian healthcare system. We just started with the patient. And that was our first product. And then we worked our way out from the patient. We iterated, and then we looked out to, while that product was in market, we were building the back end, which was going to allow all the people who support this person to be added to the experience in a platform, using a platform. But the idea was to center the experience around the patient. So anything that we did had to benefit the patient. So as we layered in requirements over the years, and now we have the SparxConnect platform, what we realized was, as somebody progresses and needs more care, it's really important to help the team collaborate and communicate and connect with each other, but also with the patient, to have that collaboration component to ensure that people feel that they are, I want to say this, that the experience of the patient is always front and center. So when you say we're a bit ahead of our time, I think it's because of the way we kind of evolved as a business. We started with the patient and we worked our way out, rather than starting with how can we build something that's going to help an organization solve a business problem. We started with how do we ensure that patients have good care experiences, and then wove in the needs of the organizations that support them. So we kind of built outwards. And what has ended up happening is that as we do all this now, and Laurie's very familiar with this, the industry research and what the healthcare system is identifying as gaps and is going to be kind of key drivers for success for healthcare organizations is really the patient experience. So it just so happens, like I would love to say I'm some guru that like knew all this was going to happen 5 years ago, but really we just stayed true to the mission, which was to make sure that this person is represented at the table when there are healthcare conversations happening, that it's done with them and in collaboration with them and not to them. And so, yeah, this is how we've evolved. I'm not sure if that answers your question, but I'm hoping for everybody here, it gives you a sense of how what we've built has turned out to be actually quite a bit different than what the competitors have built.
Yeah, and I really love that. And it's one of the things that I love about your organization. And I know that you know this, we have these conversations all the time, but your approach to product management and my approach to product management are really symbiotic exactly in that way. But what you have done exactly by doing that, right, and sort of turned this, let's call it the value model a little bit on its head, right, because you're focusing on generating value exclusively for the patient here. And yes, there are going to be health system implications to that, right? So engaged and involved patients, there's tons of statistics out there about how, you know, their care experiences are not only better, but they tend to adhere to programs better, and their, you know, their wellness just generally improves, and they cost the health system less over time. And this is something that, you know, things like your value-based care models, which are really being emphasized right now in the States in particular, but those value-based care models, and even here in Canada and Europe, we see this a lot, value-based procurement comes into play. And the one thing that I see or anticipate that might have been challenging for you, especially early on before those forces were really as strong as they were, is that sales and that procurement cycle must have been challenging because you weren't coming to the healthcare organization with a concrete business value straight line, right? That was drawing, well, if you do this, then your physicians are going to be more efficient, or you're going to be able to access these reimbursements, right? Because those weren't there, I imagine, when you started this journey. So maybe it would be worth sort of digging into that, because I certainly see this as a common challenge, right? And one of the, I'll just say this first before I pass it back to you. One of the biggest challenges that I see, especially with young med tech companies, is that they have a strong focus on, you know, reimbursements. How can I access reimbursement codes? What can our physicians bill for? Because if I can't demonstrate that they can bill for something, then they're not going to purchase my innovation. And that, in fact, is a huge misnomer, because it's the system-wide value that is actually going to make the biggest impact. And so spending the time to sort of research, much as I just outlined, you know, with yours, you know, what is an engaged patient, you know, compared to a non-engaged patient? What does that cost the health system? You know, how many more care encounters are there? How many fewer ED visits or length of stay in the hospital when we can actually involve the circle of care and involve the patient in their own care? Similar to that, any, you know, med tech company can sort of draw that value chain out and think about ways that are beyond reimbursement, because reimbursement ends up being about this big. But when you think about system-wide value, it's exponentially larger. But I know, especially in Canada, our traditional procurement cycles are not necessarily looking at that as much as they should. This is one of my pet peeves, because certainly they could, and there are frameworks for that. But you know, that conversation is always a little bit challenging. Did you run into those challenges yourself, Mary Pat, when you were, especially in your earlier days of trying to get this out to market?
For sure. This would be one thing. So if we just want to touch on, you know, a lesson, a hard-earned lesson, is that whenever you are kind of at the tip of the spear, you know, or if you're the first doing something, that if you know anything about positioning and your product, if you are the first, you need to spend a lot of time educating So you end up spending, and this is something that, just touching on conversations I had with Kevin Hood at the Accelerator Center. If you're having conversations over and over again with prospects who, become, that they have the budget, they have the authority, they have the need, and that they can make the time. So do they have band is what Kevin would talk about. This is a great fit for you. They need to understand more. You have to do a lot of work to educate them on the value. And so how do you do that when you are doing something in a new way and the market isn't pulling it out of the company? So how, they're not hunting for a product like ours online because they don't even know it's a thing, right? They don't think about building trust and relationships between their, in a home care, between a home care provider and the patient. They don't think about that relationship building and the value of that to the business. And so what we ended up doing was having a lot of conversations about other industries and the value of this approach to other industries. So what was happening when we started that they could see happening in the trends was that healthcare, there was a lot more value in healthcare, especially in private home care businesses and residential care, if you thought about it as a service. So if you think about the change that happened, let's say in the hospitality industry, that's often referred to, is when you think about how technology transformed the experience of somebody walking into a hotel, checking in, going up to their room, and then now they get an automated text message that says, hi, I'm Janice from the front desk, just want to check in to see if everything's okay. Let me know if you need anything. This idea of leveling up the service that you provide as a business, a healthcare business, is going to differentiate you from the competition. And there is a lot of competition. So it's not just simply your staff is, there's a lineup. Don't assume that there's a lineup of customers at the door or patients, that if you're when we started, it was really focused on home care. There are some communities in the US that have 635 home care businesses within, about 20 square miles. So those are densely populated, but you're still having to compete for each and every customer, which is your client or the patient. And so how are you going to stand out from the competition? Those small businesses have been thinking this way. So that was really where we went first, where it was warmest, about the value of treating your patient as though this is a relationship that you need to invest in and nurture and delight these people. And then you're going to see increased referrals. You're going to see, that it's easier to recruit talent. All of those same problems we all have with businesses outside of healthcare, businesses within healthcare have as well. So what we had to do was actually tell the story about how you're going to stand out from the competition in the private health sector in the US. That was kind of the warm place to get in and get started, and then prove out the value of what we did through all the data and evidence and the customer stories that then allowed us to move deeper into the healthcare space, which is now we're working with, surgeons. But it takes that step incremental. When I say it took a long time, it takes a long time to do something that's new and a little bit ahead of the curve.
Yeah, for sure. And we've, the collective we as a medtech ecosystem, I think have recognized that selling into the United States can actually often be much easier in here in Canada for a lot of the reasons that you just mentioned, right? There's a large private healthcare system that you can sell into. Competitiveness is a huge thing down there. Attracting those referrals or getting that payer organization to bring you into their network. How do I make my facility look like something that is appealing both to patients and to payers and to all of that? And when selling here in Canada, and this is one of the things that I really like to see of our entrepreneurs here in the area, is how can we commercialize? And yes, commercializing in the States is great. There's a lot of money to be made down there, but benefiting our own healthcare system up here, to sell into this system really does require a discussion that redefines value, because here we're not talking about competitiveness, right? That's not really on our minds. Here we need to be thinking, as I mentioned before, the system-wide benefits that can be gained. And I think a large part of education can go into, again, procurement. There are procurement models out there that will support new innovations like this. And unfortunately, they're not really well known yet necessarily. So we tend to fall back on those, traditional models. But I think there's a lot of opportunity for that. And certainly, and I don't want to turn this into a whole conversation about the pandemic. I know we're all very tired of that story, but what I've found very interesting, particularly in this context, is that the way we have engaged with patients was forced to shift very, very quickly as we entered the pandemic, right? Everything went remote. Virtual care became a thing, and we saw a lot of organizations really struggling with that. There was a technology side for sure, but then there's even, how do we establish new norms in terms of how we deliver care in this new virtual environment? And it feels to me like there would have been a shift too in the appetite and the way that patient engagement might have been looked at through that. And so I'm curious to hear, how you sort of weathered that storm, because another thing I saw was procurement almost shut down. Right? How hospitals, healthcare organizations, they shut down in terms of bringing in any new IT, or even considering those any projects that were on the go were just stopped because they were dealing with the current crisis. But then, coming out of that, as things started to settle down a little bit, there was a huge focus on, okay, we know we have a problem. We need to support these new care models. What can we do to do that, quickly, safely, and effectively? And I have to give you kudos as well, because all in the throes of all of this, then we see the announcement with IntelliJoint Surgical that you've managed to not only weather the storm, but expand into a new care setting and drive that engagement. So I'm wondering if you can talk a little bit about that. How did that affect your organization? How did you insulate for that? And coming out the other side, what sort of drove that that growth into that other sector?
So one of the things I'm going to jump into that. I'm going to answer that question. But I would like to know how many people here are actually if you could use your little reaction button, if you're listening, maybe, I don't want to put anyone on the spot, but if you're listening and you are in health tech or med tech in any way, can you use the reaction button and just click any reaction? It could be a high five. There we go. Anna, Sabrina, Renee. I know Yusuf is. I'm not sure about, yep. I got the from Yusuf. So yeah, that's good for me to know. It's helpful for me to know. So who's listening. But the one thing I would like to mention is just that for anybody here who's just starting out on their entrepreneurship journey, how we're talking about it makes it sound like, because we're kind of looking back at it in hindsight, like what amazing things we did, or all the, the insights we have. But I want to emphasize that at every step of the way as an entrepreneur, there are huge, difficult decisions to make. And it really was. So, you've touched on the pandemic. You're right, Laurie. During the pandemic, what we found was that our target market, which was home care and residential care, was not procuring new technology. And the reason was twofold. So some of them were, but they were, they maybe would have received a large grant. They were already pretty established technologies, and they might have received a big, let's say a hospital or a pilot with a new technology would receive a big kind of a huge amount of money to roll something out to support the needs of the urgent needs of clinicians and patients during the pandemic. So it was very pandemic focused, targeted money. And to get access to that, or to be one of the companies that were considered eligible for that, was very challenging. So unless you were a little bit more established than we were, you were not going to be somebody that was going to be the recipient of all of that funding. So certain companies you were seeing who really benefited because there was maybe a line item for, let's say, virtual care. And certain companies that already offered virtual care or had a simple system that could be implemented that was virtual care focused, they were really able to access that funding and accelerate their company's growth during the pandemic. But for those of us who were still, I mean, at that time, we only launched this product a few years ago, the first iteration of it, what we saw was that our sales processes just completely stopped with the pandemic. And it was justifiable. In home care and residential care, you had 30% of the team just quitting right when it started. Offices that we were dealing with, the people that were working in those offices were just quitting. So you would talk to them, you'd have a champion with your, who really excited about your product. And then they would be either taking stress leave, because imagine 3 months into the pandemic, they're dealing with they are in the trenches and it's highly stressful. And they're not rolling out a new technology. There's just no way. They're just barely getting through each day. And those were the conversations I was having with business leaders who were really excited about our product before the pandemic. And then the pandemic hit and they just said, all forward motion stops. We are just trying to get through every day. So I don't have, it was completely understandable what happened there. And in our experience, we went to our primary investor and we said at the beginning, we don't know how long this is going to last. Should we stop? Should we just stop? Should we give you, because we had gotten a good healthy amount of investment from this investor. We were about halfway through it. And I just said, do you want your money back? It's like, should we offer should we offer the product for free because it actually can help people through the pandemic and see if we learn some lessons and can come out the other side. And we're very lucky to have a very patient and supportive investor. And he said, Mary Pat, I want you to answer a few questions for me. One is, what do you think the right thing to do is? 2, do you want to do it? And 3, how would you do it? If you can answer those questions, come back to me, what's the right thing to do for the business? And that's not an easy answer. He wasn't going to tell me the answer. And so I went back and I said, I think it's right for us to take, the next 6 months at least and see if we can support these people who are going through this difficult time and without any strings attached, and see if we get some yeses and get some data and then determine what to do after that. That was at the beginning of the pandemic. That summer, he said yes, he supported it. The team wanted to do it. We all wanted to go for it. And at that summer, we started talking to IntelliJoint, and they said they were looking for a patient engagement platform to white label and run a pilot. And because of MIX, the Medical Innovation Exchange, we had just started, we'd said that we would like to move in there. Because of that, we were meeting with people at IntelliJoint who really founded MIX, they started it. And we were talking to them about marketing initiatives and regulatory requirements for software. And I asked them why they needed that information, and they told me about their need. And I said, would you be open to seeing our product? I'd love to demo for you. And they said, yeah, that would be great. And when they looked at it, they said, oh my gosh, this is like nothing we've ever seen before. Let's get it in front of the surgeon. And then then we started the path of exploring. We call it just the exploration mode. We're still selling into and supporting that one segment of home care hard, but we are now in exploration mode with IntelliJoint and getting a sense of, do we think we could succeed in patient engagement proper? And when you only have 18 people on the team, building something doing all the work required to assess whether you're viable in this new market, building features that are going to work for all those all of those different types of users, and thinking about you're kind of riding two horses at once. That puts a huge stress on the team. It's highly risky, and you don't know if it's going to succeed. And really, every 6 months, you're not really sure if you're going to succeed. Every big decision you make when you're a startup, you know, I just want to make sure everybody's aware that it's not like you go into this saying, I know everything. I'm going to come up the middle and I'm going to, you know, we're all going to win. You are constantly reassessing, should I turn left or should I turn right? You're constantly uncertain as an entrepreneur. And you just do your best to make the, you know, make the best decision you can. I think Ben Horowitz has a great book called The Hard Thing About Hard Things. And the hard thing about being an entrepreneur is that it's full of those really hard things. It's just, you just do your best. So this business of moving into patient engagement, to come to your, like your original question about value-based reimbursement, learning all the lessons, selling into the Canadian market, getting our product here, the drinking from the fire hydrant or fire hose that we've done on the learning of the differences between the two systems, and selling into Canada versus selling into the US, it is so complicated. Yes, procurement is getting better in Canada. Yes, absolutely. You know, I know IntelliJoint, Emmetros, every company, Yusuf here with Nerve, every company that is, we want to stay in Canada. We want to help our Canadian healthcare system. We want to help the people in our community with our technologies and create a better healthcare experience. The system is trying to make adjustments, but it is really hard. And in the US, they're just, because there's so much competition and all different ways of funding, you can just make changes more quickly. You can address problems more quickly. So I don't want to go too much down the path of value-based reimbursement and how that's different from fee for service. But in Canada, procurement is really challenging. Even though there's buckets of funding, my experience so far has been there's the local OHT funding, you know, there's the provincial stuff, and then there's like federal programs. And sometimes those things are, they don't communicate that well with each other about who's doing what. And so you can spend a lot of time chasing something that will never pan out because you don't know what you don't know. And that is my little bit of a, I'm going to say a warning for getting into the Canadian system. I strongly recommend you talk to as many people as you can, like Laurie, like people that advisors who are, and other companies who've walked the path before you. So, you know, companies like mine or IntelliJoints or Yusuf here, anybody that you know that's in our community trying to walk this path, that you sit down and have coffee with them before you make any big decisions to sell into it.
Yeah, no, for sure. And again, you know, fortunate enough to be in this community because there are tons of people that you can sit down and have coffee with who've walked this walk and know how to navigate it. So that's definitely excellent advice. Listen, I wouldn't mind, you know, pivoting a little bit. And I want to pull at a thread that you mentioned here that really made me think. And that was when you're talking about, you know, really one of those many times, I'm sure, through the life of your company when you had to make a decision, right? It's the pandemic, everything's shut down. Do we keep going? Like, what's the right thing to do? And you said, you know, you talked to your team and your team was on board. And, you know, everybody kind of came together, and then, you know, this IntelliJoint opportunity presented itself, and now you're sort of straddling two different worlds, right? Home care, and you're looking now into the surgical space. And again, you mentioned your team. You know, you're saying, well, my team was there, and we're really working together to sort of figure out how to strike that balance. You know, I heard this term or this colloquialism a while ago, and it really stuck with me. And that one is culture doesn't happen by accident, right? When you have a team that is so committed to the vision of the company and that is going to be there with you through thick and thin. And one of the things that I've noticed as I've worked with you, Mary Pat, and worked with your team is that there is so much cohesion there. People are just really genuinely open and collaborative and dedicated to, working together in a way that is, it's really refreshing to see. And quite often I find that this is one of those quieter causes of failure in some organization. And that is the failure to really build that kind of strong culture. And like I said, that doesn't happen by accident. So, what is your approach to bringing your team together and creating that, not to get too academic, but creating that psychological safety in your team where everybody feels free to express their ideas and their opinions and work together and sort of build that level of community within your organization?
Oh my God, this is such a big question. So the company name is Emmetros. So I very intentionally thought about all aspects of the business when I started it and did my research and was planning and writing out a business plan and all the rest of it back in 2014, 2015. And then I took a few years to really think about what I wanted this culture to be, because I wanted to enjoy coming to work every day. And what does that look like for me? And learning from my experience of leading really pretty high performing teams at BlackBerry and keeping those teams, I learned a lot there. And that it was incredibly valuable. And I'm so grateful for that experience. And what I wanted was to have, I wish there was like a pat answer to this, but mostly I wanted people to love coming into work every day and feel that it was a place where the people who worked with them cared about their success and there was a reciprocation there, so that the person sitting next to you would lean over and say, so this is my original vision, what can I help you with? How can I support you? So that was number one, that there was this feeling of care for each other. So I cared about the people and it wasn't just about work, it was about the whole person. That I didn't like that work was like there's work you and then there's outside of work you. So this business of creating a space where the whole person was valued was right at the core of it. So I think with that in mind, I knew that to attract those people, so number one, I wanted people to care about each other. So I didn't know what that was going to look like when I started. But over time, what I realized was there are lots of people that are really talented, and there are lots of people that are really kind, and there are lots of people that are generous, and there are lots of people that work hard, but that we would need to be unified and aligned in our shared mission. So that was number one. Whoever we hired needed to actually care about accomplishing the mission. And so when you go through difficult times, so that's number one, it's really important that the person who sits across from you when you're recruiting actually cares about the problem you're working on solving. And that sounds like it's crazy and must be impossible to find that person today when you're recruiting. But honestly, if you're known for being driven and all of you together, so the benefit is even if you have 3 people, a 4th person's going to hear about you and the work you're doing, and they're going to call you and they're going to say, I hear you're working on solving this problem. I hear this is your mission. I would love to be involved. So what happens is if you're known, if you have kind of a brand, which is you're intentional, you're focused, and all of you together are there passionately dedicated to the mission, that it does a lot of heavy lifting for you when you're recruiting. The other is to come back to the company name, Emmetros. Emmetros means fitting assessment, essentially. That's what it means. And so having the right people that are that have the right competencies, the right level of competency for the work that you need to accomplish, having the right people doing the right work and have kind of the right spirit, which is about collaboration and supporting each other, and their intention is to accomplish the mission. If you only hire those people and you, I'm just going to say the words, manage out the people that aren't the right fit, and that could just simply be, you no longer need that competency anymore on the team. So you're going to kind of elegantly support them into their next job, which might not be with your company because you actually care about them. They're great people, but you just have good kind of hygiene around making sure the team is well curated, because it's really kind of like a, I think of like a symphony or something. You have the right people in the right chairs doing the right work. You work beautifully together, that people love coming to work each day. So they actually think about, how can I be masterful? How can I learn more? How can I learn from the person next to me? You build this team, which is kind of where everyone's high-fiving all day. Like it's really positive, super supportive, but your job as the leader is to keep curating the team and make sure everyone feels respected and supported. If they're no longer a right fit, there's no hard feelings, because they want what's best. They want the mission to be accomplished also, and they'll be fine. Maybe they'll come back later. Sometimes people come and go. And so that's my approach to leading teams. Is it scalable? I don't know. I'm going to keep trying though. I think it is. People tell me that it's not possible, but so far I've had great success with it. And yeah, mostly. So then number 2 is, when people tell you what they want, listen to them and then just give it to them. Like, don't try to convince them that they want something else, whatever that is. They only want to work 3 days a week, say yes. Be grateful that they're going to show up 3 days a week. If they're amazing and they're a perfect person for the job, support them, support their goals, remove obstacles, find a way to give them exactly what they need. They need more software, they need a second monitor, they need to take 6 weeks off because they have some big life event. You find a way to support them, listen to them, and just believe them. Don't try to convince them that they need something else or that they need a gym membership instead of whatever it is. Like, just ask them what they want and then give them the thing. And I think we've hardly had anyone ever leave us since we started. We don't have a retention issue, and we don't have a hiring issue.
Yeah, and it's so important, right? Especially for young companies because the knowledge that you can lose with employees when they leave, and then there's, onboarding new people and everything, it's so disruptive. And, it's really a testament to see that an organization, I'm sure that starting a small company is just a little bit stressful. So when you can see that your team is through thick and thin and sticking with you through it, I think that's amazing. We're at 9 minutes to end, and I want to see if anybody from the audience has any questions or reflections on it. We've talked about a lot of stuff, right? We've talked about healthcare, navigating healthcare. We've talked about culture a little bit, different types of startup and scale up journeys. Does anybody have any comments or questions that they'd like to share? Is there anything in the chat?
Hey, Mary Pat, just a quick question for you. Related to your IntelliJoint partnership. If that goes well, are you looking to potentially investigate pivoting into other facets of healthcare?
Oh, that's a great question. So I'll tell you, we haven't gotten into the kind of the big moonshot for ourselves, that story, but essentially our architecture is also person-centered, which is, so it has a distributed architecture. What does that mean? The idea, we don't need to go into that, but essentially what the beauty of that is, if you really think about the challenges in the patient experience, it happens during transitions from one point in the care journey to the other. So our goal, why do we sell already to, why do we have hospice customers, residential care customers, home care customers, transitional care providers, and now clinicians, is that you can have, I want to say, some cohesiveness and we'll say like stress-free support for a patient who has to go through and be supported by a number of different organizations in the healthcare system from the beginning to the end of their journey. So right now, yeah, Renee, this is a great question, but absolutely our dream is that we have partners across the care continuum and that we can show how beautifully you can support a patient who's moving through it. Maybe they're in their home being supported by a home care provider, then they go and they have to have hip surgery, then they're back home again. Maybe they're at home for a while, then they end up in long-term care, and then ultimately they're in a hospice. That journey could be a lot more respectful, supportive, elegant. And so our dream, of course, is to show the value in each segment, and then show how partnerships, how the organizations that collaborate together using the platform can actually see, we'll say, greater increased value in the fact that they have these partnerships and they do manage elegant handoffs, and you are going to see better outcomes for patients as a result of things not getting dropped in those kind of bumpy points that happen in transitions. So for us, this phase of started with IntelliJoint is really tackling a big segment. I'll be honest, I didn't think we'd be tackling this segment of working with surgeons for a few more years. I thought we were really going to get a stronger foothold in home care and residential care, and then start to reach out to the partners that are in the kind of healthcare proper, hospitals and clinicians. But this, so we're a little bit ahead of where we thought we'd be. But yeah, so to answer your question, working with rehab practitioners, all of the different players in the system that work for different organizations, that's definitely in our future kind of hopes and dreams bucket, which is not well defined, I'll be honest. Like we're kind of doing it, we have like, a 3-year plan, and but you never know what's going to happen. This is the cool thing about being an entrepreneur. You never anticipate a pandemic is going to shove you into an opportunity like this. And so, yeah, I don't know if that's a good answer, but that's definitely in the plans.
Yeah, for sure. And transitions of care are it's interesting that you bring that up, because that, it's one of the biggest things that can make or break, the success or the outcome of care encounters, those transitions, and making sure that those are really smooth. And in fact, I know in the States that there's a lot of incentives that are built around that. So demonstrate how you facilitate a more seamless transition of care. So it's great that now you're having the opportunity to do that. Another area that you can plug into your your value equation, right?
It's called the Care Continuum, really. So you have all of these different players. So it's coming at it from a different angle than has traditionally been, but it's definitely a differentiator for us. Yeah.
Yeah, absolutely.